Hi, welcome to the Dana and Dr. Pearl Show, where we tackle issues that affect homebound seniors. I'm Dana Arnone, and I'm a registered nurse with a focus on senior home care for over 30 years. Dr. Pearl is enjoying a little time off today, so I will be your host. I know you're all so happy. But in this special show, we focus on the benefits of unions in home health care. To help us better understand the role of unions, we have two very special guests today. Rona Shapiro, who is Executive Vice President of 1199 SEIU, which is the Service Employees International Union, and Stephen Narvaez, who is an organizer with 1199 SEIU Union. My first guest today is someone who I've had the honor of working with in this past year. She is Rona Shapiro. Thank you for coming on our show today. I know that you're very, very busy these days. So let's start with exactly what is your role with the union, Rona?
Good morning, Dana. Thank you for inviting us, and thank you for all that you do. We are the largest healthcare local in the country. We represent 450,000 members. We are in 5 states, Maryland, D.C., we're in Massachusetts, we're in Florida, we're in New York, and we are in New Jersey. For the last 35 years, I have been privileged enough to work in 1199 with the home care workers to make their lives better, to make home care a quality profession.
But what is it that we can do to educate people out there so that they can look to joining a union agency?
In order to get the money that we want to get for our home care members, we also have to work with the employers to make sure that you have funding from either the managed care companies or the county so that you can pay a living wage, so you can give workers health care, so you can give workers a pension, or participate in the best training fund in the country. So the resources that we gather, really it's a partnership for the agency and the home care workers. And we feel that this is a partnership that has worked. We don't always agree with the agencies. They always don't agree with us, but we have found over the last 25 years that the home care agencies, they have not been considered part of healthcare delivery, and they really don't have the clout because they're not at the tables with hospitals and nursing homes. And through our work and through my constantly speaking everywhere in New York City and New York State about the value of home care workers has brought agencies to the table where they have not been at that table before.
I just wanted to say, when you talk about the essential workers and when COVID was exploding in the beginning and everybody was talking about the hospital people being essential and the nursing homes, but not one time was home care workers talked about as essential. And, that really does say a lot about the perspective that people have about home health care workers. And that's one of the things that I would like to see change over, in time. I know you do, and I do believe that the union is one way to help change the perception of home health care workers. You don't get more frontline than being in someone's home, caring for them face to face. Over the years that you've been working with the union, Rona, what have you seen change?
Agencies are fighting for survival, and they are looking to the union. And we have worked with the home care associations in New York State, who are not all union, but we need the density, we need the voices. And so for instance, with the vaccination, and obviously our mission is to help our 1199 members and first. And for years and years, as you said, Dana, the home care workers were invisible. And I feel like we've made some history during this COVID period, because you're right. Everybody or many, many people are working remote. Who is not working remote? Home care workers cannot work remote, and healthcare workers can't work remote. Our members have faced so much challenges on the bus, on the trains, getting to work during this COVID. Yet, like in the Sandy, in hurricanes, who is at the job taking care of the clients in the home is home care workers. So we, for the first time, and we had a teletown hall of 20,000 home care workers last week to talk about the urgency to get this vaccine. and the urgency to educate our members' families on the importance of the vaccine. The home care workers are now in phase 1B. So right after hospital and nursing home workers and nursing home patients, it came from both the state and the city. And it says home care workers, essential workers can get the COVID vaccine. I think that we've made a breakthrough, and it's really takes a lot of work and a lot of partnership to make sure that that the healthcare providers, the electeds, recognize the value of home care workers, and we're going to build upon that. We're going to continue to try and get this as a profession, to reschool, retool the home care workers.
That's a fantastic point, Rona, and I want to really dig deeper into how we can capitalize on this much needed attention that the home care workers are getting right now. But first, we're going to take a break, and we're going to continue the conversation with Rona after these messages. Welcome back to the Dana and Dr. Pearl Show. We're discussing the benefits of the union in home health care with Miss Rona Shapiro. So Rona, before the break, we spoke about the need to uplift the profession, change the perspective. You know, that's something that I definitely align myself with. Being a nurse, I do want my aides to be educated. I do want them to feel good about their job. I don't know that people realize that the union offers tuition reimbursement services. So, you know, if they're like being a home health aide and that's their profession and that's what they want to do, that's wonderful. But to give them the opportunity to take English classes, to take online classes, all the things that the union does offer, or even go to school to become maybe a CNA, an LPN, or perhaps an RN like me. And the union does offer tuition reimbursement. So I think that that's something that people are not aware of, and that's another benefit of the union. Other than the vaccine, Rona, what are some of the other initiatives that you think that the union is going to be taking on in this year?
For workers that don't have all the smartphones, don't live in neighborhoods that have all the technology, we have been and we will be fighting for dollars to try and get more technology to the home care workers, to get laptops, to get hotspots, so that when our members are in the home, they can communicate to the agency, they can communicate to the nurse, and intervene in what is happening in the home so that the patient can stay home. And if it's simple antibiotic, or if there's a wound that they would like to show to the nurse from the agency, so that situations can be caught quicker. So we want an investment in technology. We want investment in piloting different roles in the home. We're working with one of the managed care companies to do a pilot where home care workers are coaches. We want the workers to have more skills, but we want them also to get paid more money for that. We want to pilot a guaranteed work week. A worker may have to travel 2 hours to a 2-hour case, which pays them $25 or $30. So that is why the transportation pilot you mentioned is very important.
So one of the other things that, you know, I've been thinking about and really trying to get pushed forward and talking to people about is a clinical rotation for nursing students through home care. You know, I always want the nursing graduates or new nurses to think about home health care as maybe an opportunity that they would like to go into once they graduate nursing school. A lot of them are going to be transitioning when they graduate into some type of community service, some type of ambulatory clinic or something. But if they had the opportunity to rotate through home care, to see the patients in their home, to see what home care is all about while they're in nursing school, just make it one of their little rotations, I think that would be a great outcome. You know, we at Reliance, we set up a syllabus. We're presenting it to colleges and nursing students. It's been received very positively. So I'm hoping within the next year or so, maybe we can get that done and start bringing some more people into the home care. I know that's something that the union would be very fond of as well.
The other thing, Dana, is that we want to make, with our education fund, we want to make career ladders within home care, within the union positions. Not everyone's going to become an RN, but there's plenty of jobs. We can have coaches in the home. We could have specialists in diabetes, specialists in nutrition, home care workers who now are in the homes, have a relationship with the client. We do not need a redundancy of people going through the client's house. The system can't afford it, and many home care clients do not want that. The home care worker can help in many different ways within the scope of practice. We're not going to probably be able to do this for every home care worker, but there should be within an agency places for home care workers to move up and to do more for the client.
You know, Rona, I never really thought of myself as an employer that's going to engage the union. You know, through COVID, I know that that's something that's helped us with our employee retention. The fact that they were able to get really good health benefits for themselves and for their families. I'm hoping that, you know, we're one of the agencies that survive at the end of all this, because I do think a lot of people are going to be closing their doors. But God willing, with the help of the union and the retention of our employees, we'll still be one of those agencies standing in the end.
We respect employers like you, Dana, who take more initiative to help the workers, to help the agencies grow in a positive way, that it's not just about making money.
Thank you. I appreciate that, Rona. And I appreciate you and your time. I know it's very valuable. It's crazy times we're living in right now. So if you're in the healthcare industry and you want to learn more about 1199 SEIU Union, you can visit them at 1199SEIU.org. Coming up next, we're going to speak to my friend Steve Narvaez. He is the organizer for 1199 SEIU, and he's our organizer here at Reliance. He serves as the eyes and the ears of the union and for the workers. So don't go away. We'll be right back. Hi, welcome back to the Dana and Dr. Pearl Show. In this special edition, we're focusing on the benefits of the union in home health care. Our next guest is Steve Narvaez. He is the organizer for 1199 SEIU Union. Stephen, I'm so happy to have you here on the show. You know, we were getting to know each other as our Reliance Union organizer, and then whammo, COVID hit. So I kind of know you just by all the phone calls that you give me. But let's start by telling our viewers exactly what the role is of a union organizer.
We're the first outreach that workers will have. So as you remember, when we first started talking, I was the first one to come and talk to the workers, explain to them about 1199, about the benefits of joining the union. So what we'll do is we'll talk to workers, answer their questions, try to assuage some of their fears and concerns they might have, especially as Long Island, as you know, the union, especially in home care, is just starting to come. But we're there to basically answer their questions and showing them what the benefits of joining a union, in particular 1199, will have for them.
You know, Steve, if people would ask me, I would say that you're kind of like the buffer in between the management of the agency and the office and the worker. And that's so important because it is something that the workers look for, that they have someone that they feel is on their side. So what is the most common concern that you find that a worker has prior to joining the union?
The number one thing, obviously, is their question is about the dues. You know, home care workers, as you know, because we're constantly fighting to try to raise their income. So for a home health aide that's making, was making around $13, $14 an hour, taking away money from their monthly or weekly check is a big hit. So they want to basically know, what value am I getting for the amount of money that I'm going to be paying in dues. And union dues actually for 1199 are 2% of their gross income.
You know, Steve, one of the problems that we face here on the recruitment side of, an agency, and I'm sure other union agencies have the same issue at times, is that where we offer a certain amount of money in their paycheck, another agency might offer 50 cents, $1 more, but with no benefits. So the workers see that 50 cents or that $1 more, and they may think that that's a better opportunity for them. How are you able to help people understand the value of the benefit package that the union offers them?
People don't want to feel like they're being, let's say, like ripped off. You know, if they work and they make $1 less, someone might feel, well, I'm not getting what I'm supposed to, which, as you know, when we talk to them, the health insurance, especially during this time of COVID, I've had more phone calls from Reliance, people inquiring. These are folks that initially did not sign up for the health insurance, either because sometimes they have their own health insurance, either through a spouse, or some of them are on Medicaid or something else. But a lot of them started calling because, as we know, especially now with pre-existing conditions and a lot of our home health aide population, some of them tend to be a little older. Some of them do have some pre-existing conditions. So now health is a forefront issue for them.
Okay, so let's talk about the medical health care. It's a minimum amount out of their pocket, and you can have your whole family, except for the spouse. Wait, that's right. They can't have the spouse on it. So why? I find that so weird. So why can't they have the spouse?
as you can imagine, the more people that are on the family plan, the higher the premium, which means the higher that the premium is, the more that A is going to have to come out of their pocket as a co-payment for them, and B, the more that the agency would have to pay towards that health insurance package, which means less money that would end up in their pocket. So I think with benefits and health care benefits in particular, it's about striking that balance between offering them a good or great package, but still trying to remain competitive on the wage side. You know, because we could give them the super duper full family grandkids package, but then they're going to make considerably less. You know what I mean? So it's about striking that balance.
To me, it's a no-brainer and a great benefit. But before we continue with the benefits offered by $11.99, let's take a quick break and we'll continue our conversation with Stephen. We'll be right back. Welcome back to the Dana and Dr. Pearl Show. In this special edition, we are focusing on the benefits of the union in home health care. Stephen, before the break, we were talking about medical health benefits for our union employees and what they can get. You know, as I was thinking about it, if I had to pay for health care for all the employees that wanted it, it would be really hard. I probably couldn't afford it. So it really does help with employee retention. And with good employee retention, we are able to provide our clients with more consistent and good care.
I can also say, because I work with some other agencies, that in their contracts, we did not get the health benefits. And I've actually referred quite a number of home health aides from those agencies to Reliance because you guys do offer the health benefits. So trust me when I tell you, that it is, that health benefits is something that folks consider. And like I said, now in the time of a pandemic, health benefits is very much in the forefront of people's mind, especially when they're considering options for a job. It's like, do I go 50 and get 50 cents extra per hour, which if I have to go out and buy benefits on my own is going to be completely gone? Or do I take this job where I'm able to have healthcare benefits for myself and my kids and only pay $15 a week?
Steve, when we deal or we talk about the organizers with the Reliance, I like it because sometimes the employee will come and they'll ask us questions and then they won't believe us, and then they'll turn around and they'll call you as their organizer, and then you'll call me, and then we have a conversation back and forth, and the outcome is always the same. But what I always think about what an organizer does, I know your background is a social worker, so I'm sure that gives you the ability to have empathy for people, and you're probably a really good listener. I think you are. But as an organizer, what would you say is the most important part of your job?
Advocating for these workers. A lot of times, like you said, they call me about all kinds of stuff. Like you said, sometimes I am the only person that will listen to them. Not just listen to them, but also might be able to provide some kind of resolution or solution for them and point them in the right direction. Now, just to give you an example, recently, as of the last week or so, we've had, obviously because of the vaccine that just came out for COVID, we have had a lot of questions. 4 or 5 months ago, there was a lot of questions about people that were out because of COVID, whether they had it, they had to self-quarantine, or they had a family member. What do I do? I'm out, but I heard I could get paid, for 2 weeks. What do I have to do? So a lot of it is advocacy work. It's not a particular issue where they're having a problem on the job or with the client, or even, let's say, with the agency, which is obviously another part of what I do, but the majority of it is a lot of advocacy.
Steve, one of the things that we talk about in the office all the time is how the home care worker is never feeling like they're respected, that their voices are not heard. And that's another thing that I feel like you, as an organizer and the person that you are able to, help them work through issues or concerns that they may have. You give them a feeling of worth. Although the agency ourselves, we really do try to support them and give them what they need, but sometimes just having that person to talk to, someone who's just going to let them to listen to them and hear their concerns, I think that that's something that is really important and something that really helps make the difference in an agency in order for the workers to feel valued and supported. And I think that that's something that you do very well.
And I commend you and your agency and your staff, because the relationship obviously with each agency and each management team is very different. And you guys have a great team, and I think we have a great relationship, and it really allows us to provide as much assistance, and like I said, advocacy for the workers, because they're the ones that are out there. If they're not out there taking care of those clients, neither one of us are going to have a job.
Yeah, I know. And one of the things that we did here in Reliance, because we were so aggravated about the lack of respect and recognition for the home care workers, is that we took it upon ourselves to do a commercial just to thank the home care workers and tell them how valued that they are, and that we see their efforts and their good work. You know, not just as a Reliance owner or the people that work for me. It's people all across that get up every single day and left their families to go to work. So we just wanted to say thank you. So we put out this commercial. It was on BLI and a couple of other radio stations, just as a thank you, because we didn't hear thank you from anybody else.
How many workers that I've spoken to during this time that got COVID themselves or someone in their family, and they literally almost couldn't wait for the 14 days to be up for them to get it clear so they could go back to taking care of their client or their patient. You know, they literally were thinking, I hope my client's going to be okay, my patient's going to be okay, because I'm not there with them, and putting others, literally others, before themselves or even their families. Another example is when Hurricane Sandy came, and some home care workers made the decision to stay with their clients, because if they went home, no one would be able to get to their clients, in Far Rockaway in particular, and really bad things could have happened if they were left alone. So they literally forsook their own families to go home and be with their children and their families during that time, and stayed with their clients sometimes for weeks.
You know, we actually did have a situation where we had a patient test positive for COVID. The aide was there with him, and the aide said, well, I guess I'm just going to quarantine, and stayed there for a couple of weeks with the patient. Didn't leave. She figured I was already exposed, so I might as well just stay and take care of him. And she stayed where the family didn't go and visit, but she stayed and took care of him for the 2 weeks until they were both out of quarantine. So that's pretty amazing right there.
And that's the unbelievable thing about these workers, because they do this.
Thank you, Stephen, for coming on the show today. I know you play such an important role in the giving of our healthcare workers a voice that they so well deserve.
Hopefully soon we'll get back to being back in person and really getting down to the work that we need to do. Yes.
That's the end of our show today, so I hope you enjoyed it. Let's stay connected and help us help you take care of your loved ones. Follow us on Facebook, Instagram, and Twitter. We'll see you next time on the Dana and Dr. Pearl Show. This is Dana Arnone, registered nurse and the owner of Reliance Home Senior Services. I'd like to take a moment to share with you the privilege that I have each and every day working with my personal home care workers at this very troubling time. These home care aides are working hard to help keep those not infected out of the hospitals, thereby lessening this high capacity load we are seeing in our hospitals at this time. So let me personally thank all of my aides and all the aides that are out there for the brave and great work that they do. We validate you, we see your hard work, and we thank you.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.